welcome to the Vlogging Pod. Today, I want to talk to you about something weighing heavily on a lot of American minds. What happens if Medicaid is cut or taken away? This isn't just a policy debate, it's a real fear for families, caregivers, seniors, and people living with chronic or terminal conditions. So I want to walk you through what's at stake, but also explore what options might be available if the worst does happen. Because even in the uncertainty, there are people trying to help, programs fighting to stay funded, and paths that might still provide support. So let's break this down. What's exactly happening with Medicaid? Right now, there are proposals and pressures that could drastically limit who qualifies for Medicaid or eliminate it entirely in some states. That means millions of low income Americans, especially seniors, people with disabilities, and families with children, could be at risk of losing access to health care. Cuts to federal funding or shifting Medicaid into a block grant model could lead states to impose stricter, more requirements, reduce services, or drop people altogether. If you lose Medicaid, what are the alternatives? If you're worried about losing Medicaid, here are some other programs worth exploring. Federally qualified health centers, FQHCs. These centers offer care on a sliding scale base of income. They provide primary care, mental health services, and often dental or pharmacy access. Hill-Burton facilities. These hospitals and clinics are required to offer a set amount of free or reduced cost care each year. State-based health exchanges. Even without Medicaid, you may qualify for subsidies through the Affordable Care Act marketplaces. Charity care programs. Many hospitals, especially nonprofits, have internal programs that write off bills for low income or uninsured patients. Discount prescription programs, GoodRx, Needy Meds, and state-run pharmaceutical assistance programs can dramatically reduce medication costs. Medicaid buy-in, if available in your state. In some areas, people with disabilities or chronic illnesses can buy into Medicaid, even if their income is slightly above limits. Long-term or terminal care grants. If you're dealing with a serious or life-limiting condition, some grants and support services may apply. The HealthWell Foundation helps with insurance premiums, co-pays, and medication costs. Patient Advocate Foundation, PAF, offers case management and grants for those with chronic or terminal illnesses. Cancer Care and PAN Foundation provide financial assistance to cancer and chronic disease patients. State vocational rehabilitation services for those unable to work due to illness or disability. These programs can help with care, retraining, or other life-supporting services. The bigger picture and the hope. We're living in a time where healthcare feels less like a right and more like a privilege, and that shouldn't be the case. But even as federal systems shake, there are grassroots efforts, multiple aid groups, and even local organizations rising to meet the need. No one can replace what Medicaid provides on a national scale, but there are pockets of support. And if we shine a light on those, we can help people hold on while still fighting for a system that doesn't abandon them. Now, I know this topic can feel very heavy, and it is. But if you're facing uncertainty about your health care, You are not alone. There are places to turn, there are people still fighting for you. And here on the vlogging plot, I'll do what I can to make sure you know about them. Our information for tonight comes from sources such as KFF, needymeds.org, ssdi.disabilitybenefitswork.org, Health Wealth Foundation, Patient Advocate Foundation, Cancer Care, Tennessee State Government, Kelsey Moran, InternalWealthHealth.com, Find Help, Facebook, Stop Scrolling the Pan Foundation, Enhance Premium Tax Credits for ACA Health Plans, GoodRx, HRSA, Peterson Foundation, US Gov, Veterans Affairs, Tennessee Disability Fast Finder, KFF, IRS, Consumer Financial Protection Bureau, WebMD, Experian, LTSS Choices, Pan Foundation, CSG Seed, PA Times Online, SHVS, Bureau of Primary Health Care, hsstate.gov, KFF. Thank you for listening. And as always, until next time, bye-bye for now.